Hello everyone, it's been a while and I believe we are all doing great. Okay, so in today's video, we are going to learn about STIs. Okay, we are going to learn about STIs. We get to know the definition for STIs, and then STDs. We get to know the difference between STIs and STDs. We get to know some examples of STIs, and then we get to know the causes and the effects, the prevention or control for these STIs. Alright, so sit back and wait to learn something new. So, first and foremost, what is an STI? And we know by the definition, or like it comes from the full meaning of STI. So STI means sexually transmitted infection, just as we all know, whereas STD means sexually transmitted diseases. Well, one will ask, what is the difference between STI and STDs? The difference is that one is an infection and one is a disease. Now, what is the difference between an infection and a disease? An infection is simply when a microorganism invades the body or the tissues or the organs. Then it becomes a disease when, as a result of the microorganism invading the body, the body or the organs, or it begins to malfunction. It begins to show abnormal signs and symptoms. Diseases actually comes with signs and symptoms, but if someone has an infection, the person may show no signs or symptoms at all. So that is the difference. That is the difference between the two of them. And we could say that a disease is the last stage of an infection. Okay, so an STD can mean that is the last stage of an STI. That is simply the difference between these two words here. So we have examples of STIs, and then we have gonorrhea, we have syphilis, we have human papilloma virus, we have the HIV. There is the trichomoniasis, genital herpes, genital warts, pubic lice. There is scabies, and then a whole lot more. So these are some of the common types of STIs that we know about. So from time to time, we will be taking these STIs one after the other, and then we get to know more about it. Probably that will be in different videos, but today is a general look at STIs. Okay, talk of how STI is transmitted. As you know, the name says sexually transmitted disease. So from anal sex, oral sex, or normal sex that we know, you can get these diseases. Although it's called sexually transmitted infections, it doesn't mean that it can only be transmitted through sex. It can also be transmitted through the sharing of objects like sharp objects or like needles or blades. And it can also be transmitted through childbirth or even through breastfeeding. It could be transmitted through getting in touch with body fluids as well. Yeah, you can get them through body fluids as well. And you can also get them through, probably if you use a public washroom, you might get certain STIs from there as well. So it's not transmitted only through sex. So symptoms of STIs could be unusual discharge from the vagina or the penis, could be bleeding too. It could be pain during urination, and sometimes you see lumps or some rashes grow around the genitals, and then there is itchy vagina or itchy anus or itchy penis. There could be sores or blisters around the genitals, and then if they are warts, you could see the warts appearing on the genitals or in the anus. Then there could be also warts in the throat or in the mouth, but that is very rare. So basically, those are the common signs or symptoms of STIs. Yeah. So let's look at the risk factors of STIs. So the first thing is having unprotected sex. When you have unprotected sex, I mean having sex without the use of a condom, whether male or female, then you are at risk of having STI when you have multiple partners, when you have multiple sexual partners, you are also at risk of having STIs. And if you have a history of STIs, let's say you had an STI before in a couple of years back, you are still at risk of having an STI. And then anybody who has been forced to have sex or have any sexual activity is also at risk of having an STI. And then misuse of alcohol or misuse of drugs like weed and then tobacco. Misuse of these drugs also makes you at risk of having an STI. And then those who share needles, okay, those who share needles a lot, so they are also at risk of having an STI. And because STIs usually occur between the ages of 15 and 24, most young people are at risk. So probably if you are between these ages, then you should be more careful because you are at risk. And then men who request prescription for drugs to treat erectile functions, yes, those erectile function drugs, most of the men who take them are also at risk, so basically those are the risk factors. And then we have a look at the complications of these STIs. The complications could be pelvic pain, pregnancy complications, there could be eye inflammation, there could be arthritis, you could develop pelvic inflammatory disease. At worst, you can even be infertile, so infertility can set in. You can even have heart disease and then certain cancers. Okay, certain cancers. So someone may ask, how do we prevent STIs? How do we prevent, or how do we protect ourselves from STIs? And then the first thing we could do is abstain from sex. Abstain from sex. I know some of us were taught the ABC method. So abstinence, being faithful to your spouse, and then the use of condoms. So these three can help us. Yeah. And then you have to wait and test when you have unprotected sex, or probably come in contact with any fluid or something. Well, what you have to do is to wait to get tested before you go ahead to have sex with anybody else or have any sexual related activity. Another way to prevent it is getting vaccinated. As you know, hepatitis B is also an example of an STI, and then I know there are vaccines out there to protect against. Another way to prevent STIs is you don't have to drink alcohol excessively, or and then another way is to communicate with your partner. Like, just talk to your partner that you have to be safe. You have to protect yourself, so you have to talk to your partner, you have to communicate with each other so that you work together to protect yourselves against this the contraction of this. And then every male has to be circumcised. There is outer flesh around the penis before circumcision, and then mostly those skins infections can hide, or viruses or bacteria can hide beneath the foreskin of the penis. So once you have a circumcision, it becomes safer. So it's advisable for all males to have circumcision. Basically that is that for the prevention of STIs. So someone will ask, how do I get to know if I have an STI? I mentioned some of the symptoms up there. So when you realize you're having these symptoms, and then you had unprotected sex, then you need to see your doctor, because the best way to diagnose an STI is through blood test or urine test or body fluids or the discharges. They will just take it and then run a test, and then they get to know whether you have an STI, and then they get to tell you what kind of STI you have, and then you get to know the treatment for the STI. The treatments for STIs, most STIs are treated by the use of antibiotics, probably strong antibiotics, but the best thing will be for it to be diagnosed in the hospital and then your doctor prescribing a drug for you, self-medication is not advisable. The effects of STIs on us or the person having an STI, as I already spoke about in the complications, probably could lead to infertility, could lead to pregnancy complications, and then a whole lot. That is the complications. Also, STIs have an effect on the nation, or have an effect on the nation, because as I said, the people who are mostly at risk are the youth, okay, or the young ones. And then we know that to contribute to the productivity of a country or the nation, the youth is needed the most. Now, if the youth are suffering from sexually transmitted infections, it will cause low productivity, and that is going to have an effect on the nation. Okay, so that is that for today's lesson on STIs. As I said initially, we're going to delve deeper some other time. We are going to take these STIs one after the other, probably a few common STIs, and then we look at them into details. But for today's video, that is the end. That is the end for today's video. Okay, so if there are any questions, suggestions, or comments, just leave them below the in the comment section, and I'll go there to answer you. Alright, so thank you very much. In today's video, look at STIs and STDs, their differences, and then we look at the causes, we look at the symptoms, we look at the effects, complications, prevention, and yes, that is the end of our video for today. Alright, let's all remember to stay protected, wash our hands, wear our nose mask, because coronavirus is real. Thank you very much and enjoy the rest of your day. I love you all. Bye bye.